3 or 4 days this Zeynep Beringen. It will be a special event. We have already an experience 3 years ago. We gave you a program, but the program is not really useful. It's useful for the points for your professional organization, and you will see that Zeynep is very predictable but unpredictable. And well, that putting on a paper so that your professional organization will understand what's going on is difficult. So I just made a program for 4 days, for 5 days. You won't see it, but it's just a formal thing. I think, Zeynep, you will introduce yourself, or do you want to write something?
I'll introduce myself.
Okay. You will see a lot of video material. And I think that's the most important thing of these days, watching and trying to understand what's going on. So have a very inspiring and successful and useful day. The last thing I forgot already, the secretary is telling me there are forms with all your names, and you have to signature it, and you have to put your professional organization on it, and especially your big number. Only if you fill all those forms well enough in, you can get your points automatically. If you don't complete everything, well, I'm sorry, but that's our point. So if you miss your big registration number of things, please mail to Anneke Timmers, she's there, sitting there. You have all her email address or your ask me. But we will serve for the points, but you have to fill everything right. Okay, that's it. The floor is yours.
Okay. Well, thank you so much for inviting me once again.
Is it already?
It should be on.
Okay, I heard. Yes, that's right.
Is it on?
Yeah.
Okay. I have to have it pointed to me a little bit more, maybe. Okay. Can everybody hear me? Make sure that, yes, this is good. Closer. Yes, thank you so much for inviting me once again. And we will have 3 days that's very full. And basically, this is the basic course for EA, at least the face-to-face portion. And then you will have a distance or online portion in which you do the inter-rater reliability with us. And that will be done just one individual at a time with us. So you will complete a scoring sheet and send it to me directly. I'll give more instructions later on with that. But not to worry about that at this point at all, and just to feel comfortable getting to know the material and the course, and I will work with you on the reliability portion. You have transfers of agreement in front of you. Has everybody completed that? If you could pass that to the left and then to the front, I will get them all. What that gives me is permission to share videotapes with you. And your understanding that this is all confidential material, not to discuss it outside this room with other people. It's all professional things that you're used to, confidentiality issues, nothing out of the ordinary.
We have 2 more things.
2 more. 2 here. 3 more. So unless I have this from you, you won't be able to see any videotapes. So I took this first, and then you have to go scan, get a signature, send it on email, all very inconvenient. So this is the best way to get it from you directly. Is it dark? Is it too dark?
No,
The film?
we'll manage.
This is the right place to stand?
I think so. I don't know.
Not too dark?
It is a bit dark.
Oh,
I think it's too dark.
Oh,
Maybe we could have the lights on a little bit. Yeah, because we'll first be doing lecture anyway.
It is better, but if these spots could be on, yeah, that's good.
It's better.
Yeah.
Kind of standing here.
Yeah.
Okay.
Well, no, that's it.
A little more light, yeah. Okay.
Yeah, that's good.
Okay. So, we have a big group, and if we went around the room, I'm not going to remember every single name and which institution you're from. And maybe other people would not either. I wonder if we could go around the room and say which institution you're from. If you're sitting at the same table, which chances are you may be, just to get a sense of where people are coming from.
University of Kassel and Sigmund Freud Institute in Frankfurt.
Wait a moment.
Yes, I need to.
University of Kassel and Sigmund Freud Institute in Frankfurt, in Germany.
The same. I'm just making fun. I work at Demens in healthcare.
I'm sorry?
Demens.
Demens, okay.
I work in Sandbergen. Zandbergen Jeugd en Opvoedhulp. I work at this location.
I'm working here.
UTC, okay.
Me too. That takes a minute.
Zandberg. 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 Jeugd en Opvoedhulp.
Sluimzorg naar Nederland. Elkaar.
Joneo vaste kerk.
Joneo Vastenkerk.
GGZ Breburg.
GGZ Breburg.
Me too.
Akader en NIFP, Forensisch Instituut. Slagersdorp naar Nederland.
I'm working here.
Me too.
GGZ Breburg.
GZ Breburg.
GGZ Breburg.
Julius Vaderweg.
Me too.
Me too.
Ja, deze.
I'm going to be interviewer voor megazorg.
GGZ Student Alloceren.
GGZ Drenthe.
GGZ Drenthe. GGZ Drenthe. SS Interprovinciaal GGZ Utrecht. En Lucert is het nodige Amsterdam.
I also work here.
Private practice.
Zandbergen in Utrecht en Amersfoort.
En GGZ Drenthe de Bron.
Alsjeblieft.
At different points when you speak.
Onthoud
we
maar
will.
elkaar, dan kunnen we die gebruiken voor de grote groep.
Ja, oké.
So,
Okay. Ik niet te veel fluisteren. Of zet je me uit?
Ja, ik zet me even uit. Dat is wel handig, toch?
so I will start with lecturing about attachment and emotional availability. And then we will follow with video-based examples and really start scoring with them. But first I'll give you a theoretical, conceptual overview, as well as some research-based information. So some concepts from attachment theory and research. John Bowlby's internal working model is definitely an important aspect of the way we think, associated with EA. Internal working model is a representation the parent or the child forms about specific relationships. And those representations of relationships tend to persist over time. And so they're not just views of someone for a fleeting moment, but they're feelings and representations, thinking that guides that relationship, as well as potentially other relationships that one might have. So there's sort of a guiding role once you have an internal working model, particularly about mother or father, then that representation, be it secure or less secure, has a guiding role in terms of how you feel and think about other relationships. And that's John Bowlby's contribution to attachment theory. Ainsworth's secure-based behavior is another important attachment-based concept. And what is secure-based behavior? From your readings of attachment.
Going back to the adult after exploring himself.
Going back to an adult, significant adult, after you have had a chance to explore the world. And so basically the secure base concept became well known after Ainsworth's research in Uganda, where she was doing a great deal of home observations of babies and their mothers. And what she saw was, in the natural setting of the home, Ugandan babies went, explored, but then they came back and rechecked, reconnected with mother. Feeling secure again, they would go and do other things and then come back and check. And what she noticed is that some babies did just that, but other babies did not. A smaller number of babies tended to explore but they didn't come back and check as often as this larger group. Still, some stayed very close to mother. And then she saw in her US study in Baltimore the same thing, that there was this attachment exploration balance for the majority of babies. For a smaller group, about 30%, they explored a lot, but they didn't come back for the comfort of the safe haven of the mother. And still a smaller amount of babies just stayed and clung to the mother and did not explore very much. And so there were these three patterns of secure-based behavior that she observed. It's very important to keep in mind secure-based behavior as you watch EA tapes, because even though all of the children are not on the floor and at an age where they would go and come back, move away and move back, because some of them are older, in conversation or in interaction, do they go off and do autonomous things and then look for mom's input and advice? Or are they constantly with mom, wanting her approval, advice? Or are they constantly on their own, kind of turning their backs on the mother and going off on their own at a more level of the idea? So in the babies, you may be able to see moving away and moving back, moving away, moving back. But in the slightly older tapes that we will also see, in conversation, in play, are they constantly looking at mom? Or are they constantly on their own? Or do they show secure base behavior and connection? An appropriate level of autonomy with connection. So the secure base idea is a very profound one that has influenced attachment theory and research, and that is very practically observed in a large space. And it is actually observed in a smaller space at the level of conversation and exchange. Ainsworth's concept of maternal sensitivity is another one that is very, very profound and has influenced our way of thinking and research. What is maternal sensitivity?
The way you how the mother reacts to the child, giving them, looking at the child, and then given the freedom to explore, but also seeing the needs of the child, but not being intrusive.
That's a lot. Okay, the maternal sensitivity concept predominantly is about the mother perceiving the child's cues correctly, so the clarity of her perceptions. So if a baby is crying, a mother who is sensitive would know what type of cry that is. So if the baby's crying because baby wants to go to sleep and the mother goes and gets a bottle, that would be less clarity of perceptions, because then her responsiveness is to what she perceived rather than what really the baby needed. But it's about clarity of perceptions and the appropriate responsiveness to those perceptions, mainly. Now, you said a few other things, like not being intrusive and so on. And in the original Ainsworth conceptualization of sensitivity, it's really mainly about clarity of perceptions and responsiveness. Now, some others who have coded sensitivity have put other things in there, some of which you said. The Ainsworth concept of sensitivity is really one about clear perceptions, accurate perceptions, and being aware of the cues of the baby and responding appropriately and promptly to them. So you might think, yes, my baby is crying because my baby is hungry, but you don't respond promptly to it, and instead you do other things, and then only after your baby has fallen asleep do you go get the bottle. So that would not be as sensitive. As you will see, the sensitivity concept is important in the EA conceptualization as well, because the EA conceptualization really comes from a foundation of attachment concepts. But it also goes beyond the attachment concepts. It starts there, and it's the most important foundation for the EA conceptualization. But as you will see, the EA way of thinking is slightly different with respect to sensitivity. It also adds other qualities to it, and we will get to that description shortly. But I just want to say that the Ainsworth concept of sensitivity has been so important in attachment and attachment-relevant work that it has become difficult to move beyond sensitivity. And a recent paper that I came across of a dissertation student was very nice, because the title itself said, I think it was Moving Beyond Sensitivity. And it was on emotional availability for children with cognitive disabilities in an international setting. And this one was in India. And basically, you might think it's very natural to move beyond one concept. But it's been very difficult for attachment thinkers to move beyond it. And there are many reasons for that, I think. Some good ones, and some of familiarity. But it is important, I think, to move beyond just one concept, because it predicts attachment only at a moderate level. There are also other things, but in addition, not everything about emotional availability is about attachment. There are things that are different than attachment that the concept includes. That's another reason to move beyond sensitivity. Still, an additional reason to move beyond sensitivity is the research information. What does the research indicate about the importance of maternal sensitivity versus other qualities? And we have been impressed with such things as the mother's intrusive behavior. For example, in Finland, where they do a lot of research on drug-abusing mothers, as well as those in treatment for drug abuse. And what they find is that mother's intrusiveness is more interesting than sensitivity. Further, that they can actually change some other aspects of emotional availability more easily. We also have found that we can, by intervention, change other qualities, such as structuring, more easily than we can change sensitivity. And then there's sort of a ripple effect that it can improve over time. But we focus more on some other aspects of emotional availability. So there's a variety of reasons for looking at more than sensitivity. The child side is also another reason. We find that we can change the child side of emotional availability, which is really interesting, without changing sensitivity, for example. So the use has been very, very prolific, but there has been overuse in research because of the emphasis on attachment. What are the attachment categories? These are the well-known 3+1: secure, insecure, avoidant, insecure, resistant, as well as disorganized. Does anybody need a review of the attachment categories? Everybody very familiar?
No, I would like.
A brief review?
Yes.
Okay. So I'll go into role play mode. Secure. Typically, attachment is assessed in the well-known procedure of the strange situation. And it's a laboratory situation, unfamiliar room. It should not be done in the home setting. It needs to be an unfamiliar room to be a little bit stressful. And it's 20 minutes. And it really needs to be done in the same way all the time, because that's where the research validity comes from. And it starts out with just coming into a room that's unfamiliar, few minutes of play or interaction between mother and baby, and then they sit down, a stranger comes into the room. After a little time, the stranger talks to the mother, how was your parking, and so on and so forth. And mother, after a little time, leaves the room. Baby's with the stranger. Mother can actually see her baby, usually from a one-way mirror. Baby doesn't know that. There's a little bit of interaction between the baby and the stranger. And then the mother, after a little time, comes back in, so there's a reunion. And then during the 20 minutes, there is a time when the mother and baby are together, and then the mother leaves, but the stranger is not there anymore, so the baby is by itself. So there's a few minutes where the baby is by itself, and then you look at the baby's behavior, and then there's a reunion between the baby and the mother. The key things for attachment scoring are there 2 reunions between the mother and the baby. The most important is the second reunion, because by that point the baby has become more stressed. So cameras follow the baby and mother during reunion, and you capture the moment of the reunion. And the reunion lasts 3 minutes, but you captured the moment of reunion, especially visual gaze. Is there eye contact? Because some babies who are avoidant will, when mother comes in through the door, will do just a quick look away and then go to the mother. And so that would be a mild avoidance. Others do very, very obvious kind of avoidance. The secure babies have a nice greeting to the mother and then go to mother, show her that she was missed. They might cry, but then when mother soothes, they become comfortable and soothed, and then you see the attachment exploration balance. After being soothed, they go off and explore, and then they come back. But you see that the interaction is well-rounded in that the stressed baby is calmed by the mother, but then can resume activities, goes to the toys. The avoidance are mild avoidance, kind of looking to the side. Maybe it's just the eyes that you see which avoid the mother. Or it could be very, very clear postural cues. Going to the corner, cowering. The other pattern is insecure resistant, where it's the opposite attachment exploration balance, in that the mother returns, they're very happy the mother is back, they go and cling, and they don't stop crying, they don't stop whining. So the mother's comfort is not enough, it's just never enough. And you usually see those babies whimpering, crying, even as they're leaving the laboratory. So they don't get the comfort and then go off to explore. They remain needy. The comfort is not enough. The disorganized is interesting in that they may go toward the mother and then kind of go around her. So they're not approaching her directly and getting comfort. They go to her as if wanting that comfort, but they might go to her back and just stay there. Or they go to mother, get picked up, and as they're picked up, their bodies are limp, and they may be just looking to the side. So it's not this nice hugging, but it's their bodies are frozen and limp, or they just look to the side, while they're not fighting to get off mother's lap. Disorganized is often a mixture of avoidant with resistant behaviors, or some bizarre kinds of behaviors. Some disorganized infants, when the mother enters the room, might just still. Or they might look frightened, and they just stay that way. So just behaviors that are a little bit unusual, or very unusual, depending. I have had mothers return, and the baby is fine with mother's return, but tries to go out of the room to find the stranger. Cries when the stranger leaves, but not when the mother leaves. So it can be kind of a mixture of things. Emotional availability theory and background is really an integration of attachment way of thinking and an emotional perspective. Attachment theory is the greatest social development theory of our time. And in fact, it's the greatest social emotional development theory of our time so far. But while emotional development is an important part of what attachment predicts, it doesn't, in the scoring system, it does not take into account emotions. In other words, in the strange situation procedure, you look at behavior, not at affect, when you're scoring. When you actually look at the face, yes, their faces look different from one another. The avoidant babies look more emotionally shut down, but that's not what you're taking into account when you're scoring. You're scoring behaviors. Are they turning away? Are they seeking proximity? Are they seeking contact? Do they maintain contact? So the actual scales for scoring are behavioral scales rather than emotion scales. And emotional availability really comes from some frameworks that really highlight the importance of emotions. Margaret Mahler used the term emotional availability and said that when the mother is present physically and emotionally available, that the baby can go away and explore. That her presence makes it possible for the child to go and explore, but then to come back for what she called refueling. But it was a brief use of the term emotional availability in 1975 in the Mahler, Pine, and Bergman book. And Robert M.D. used the term emotional availability next in the context of therapist-patient relationship. So being a psychoanalyst, he used the term to describe the emotional availability of the therapist to facilitate the client's exploration of old and new information. That it's not just the physical presence of the therapist, but the therapist's emotional availability that facilitates exploration of old and new information. In emotional availability theory, the contexts of observation are a little bit different than in attachment. Attachment, like in a strange situation, is for stress situations. How does the mother and child interact? How do the mother and child interact in a stressful context is what attachment is about. And emotional availability is about both. It can be in a stressful context, it could be in a non-stressful context, and I might add that the non-stressful context includes pleasurable interactions. It is not just important how the relationship is under separation and reunion, but it is supremely important also whether and how relationships are under pleasurable circumstances. Can they have a good time? It's not just the absence of stress and distress that's important, but pleasure, a good time, enjoyment of the relationship is also important. And emotional availability is about the range, not just that range associated with attachment. survival, getting fed, getting soothed when you're in distress because of separation. But it's also about this whole spectrum, whole range of interactions. And playtimes are important. It's not just how mother soothes you when you are distressed. So in research, emotional availability concept is helpful because it's a timeless concept. What do I mean by that? Attachment mainly can be seen in the strained situation at 12 to 18 months of age. 12 to 18 months. You could stretch it to 24 months in the strained situation, but you should not do a strained situation past 24 months. Preferably you end it at 18 months. That's the validity of the context. And that's what is stressful to babies. Once you get to 30 months, the strained situation procedure is no longer stressful. So then you have to go to other situations. But emotional availability as a concept, the 6 EA concepts are the same, whether you're looking at a 6-month-old baby, or you're looking at an 18-month-old baby, or a 3-year-old toddler, 5-year-old, and then, so what you have and will receive training in will be the infancy, early childhood version. And what about past that time? Well, we've had this for a long time, the middle childhood youth version. We've had it for a long time, but now, the day before I got on my airplane, it's in published form. So this is actually just the proof, and I have to read it to make sure it's correct from the publisher, but it's as a book, recent, but we've had it in Xeroxed form for quite some time, and researchers have used it, clinicians have used it for many years. So there's not as much research on this middle childhood youth version as there is on the white manual, but there is still a lot. The point of this is this version is still the 6 EA concepts. It doesn't change. The scoring is described for an older population of children, but the concept itself is timeless. And there is now extensions of the EA concept to other populations that illustrate the timelessness of the concept. But basically, it's helpful to research because you don't have to change instruments. If you're following children longitudinally, and they go from 2 years to 4 years to 6, and you're going to follow them, you don't have to change instruments. Whereas if you were scoring attachment, you would be able to do the strange situation and then do a different system later. Some of them less well validated as compared to the strange situation, but you have to change instruments. You can't just use the same instrument throughout. And that is a true usefulness to the researcher doing EA. Another usefulness is you don't have to worry about doing too many EA assessments in your clinic or in your research. You can do one every day. If you have the time and resources. But the strange situation you cannot do every day. You have to let at least 1 month go by before doing another strange situation. An EA assessment you can do as often as you have the time and resources for. Another strength for researchers, how many people are planning to use EA in research settings? Number of people, yeah. It's a continuous measure. So to move attachment from insecure to secure is a move from one category to another. And the evidence indicates that it takes more effort to move attachment categories. That makes sense. And the research supports that. But EA being a continuous measure is sensitive to change. You have, with the direct score, 7-point scales. So they can move from a 1 to a 2, 2 to a 3, 3, 4, and so on. With the additional approach that has been added with the 4th edition of the EA scales, you actually have 29-point scale, as you will see. And the 29-point scale gives you opportunity to not only describe any clinical sample with a lot of range, but it also allows for measuring improvements over time. This is important to sometimes the person who is experiencing the change. But in terms of research, you can see smaller changes and document smaller changes. With respect to clinical work, you don't have to set up a stressful situation. I will go into when it is useful to set up such a situation, but you don't absolutely have to. You can do EA in a hospital setting, in a doctor's office, waiting room. You can do EA in your playroom. You can do EA without an elaborate setup. You need a video. But outside of that, the research and the researchers have provided us with, let's see, how many years now? Almost, well, over 20 years of evidence that regardless of contexts, EA can be scored reliably, validly, with validity, and it seems to predict regardless of the context. There are some limitations to that idea, however, which I will go into later. But chances are, wherever you film, if you film 15 or 20 minutes, you will get an indication of the relationship. In clinical work, I already mentioned with respect to research, you can measure more than once without worrying about stressing the child. If you're working with foster caregivers, foster mothers or fathers, who have foster children or adoptive families, you don't have to worry about the ethics of additional separations for the child. You can do EA in a non-stressful situations. You can do EA with mother, followed by grandmother, father, and so on. You don't have to really separate them in time. Again, for the clinician, if you're doing therapy or you're doing intervention work, the continuous scale gives you an indication of improvement more easily. Further, it's multi-dimensional, so you might see a mother who is good in sensitivity, but not so good in structuring. Maybe someone who is low in sensitivity, but also non-intrusive. So as you're doing clinical work with them, you could work on the areas needing change and growth. But they also may have some strengths that you could start with. For example, they may be non-intrusive, and that's a good thing. The videotape is a stressor. So I just want to emphasize that. You're still stressing the system in some way because you're videotaping. Another key quality is that the child, now this point I will say, but it will go very quickly in practice. When we apply this to cases, the child is the cue to the relationship. But from my experience in training people, this quality goes very quickly. It's easy to say, but it's not easy to implement. Okay. Focus on emotional cues. This also goes it's said easily, it makes sense, but until we actually apply it to practice, it's one that's difficult to emphasize. What is the emotional? But I find that people focus on the behavioral, but not on the emotions. For example, with sensitivity, you might see a mother who says nice things, and people point out that she says nice things. But then I say, well, how does she look when she says nice things? And they say, well, she doesn't look so good. But she's sensitive because she says nice things. But the emotional availability scales is about looking at emotions as the background for how they behave. It's easily said, but it goes quickly. It's also about not just counting discrete behaviors, but it's about putting together a whole package. So what does this mother sensitivity look like? Finally, the last statement here is that each dimension is dynamic, systemic, and not an individual quality. This hints at the importance of not just attachment, but that there's a systemic quality to EA. So our EA with one another is not about me and it's not about you. It's about how we interact with each other. And that's very much a family systems way of thinking. That a person is not high in EA. It's a relationship that's high in EA. Sometimes that's easier to think about in terms of other relationships. Let's say a couple's relationship. There are certainly enough people who don't have a very good relationship with one person, but they have good relationships with other people. So it's not a trait of the person, but it's something systemic. It's about how the two interact with one another. And that's the same for the parent-child relationship. EA should not be thought about as a trait of the individual. EA could vary across relationships. And we know that in the same family, the EA of the mother can be different with different children in the family, even with twins. We know that the relationship with one twin is different than the relationship with the other twin. They get different scores. So the emotional availability scales are not telling you about the emotional availability of one individual. When you look at the child's point of view and you're coding child EA, you're not saying this child is an emotionally unavailable child. You're saying in this relationship. And I have tapes to illustrate differences of 3 or 4 points between the child's EA with mother versus father. And they almost look like different people. And so there are instruments out there to code the adjustment of the individual child. Things like tools like ITSY, BITSY, CBCL, correct? Those are to look at the adjustment of the individual child. EA is about the relationship. And then just another concept is reworking of emotional procedures versus declarative knowledge. What might that mean? Well, EA is not about mentally what the mother or father has learned through a textbook. That would be the declarative knowledge. It's about whether or not they have the emotional procedures. It's not as easy for people to rework their emotional procedures. It's easier for them to say nice things because they know that's a good thing to do. They may not say nice things when you're not filming. But the emotional procedures get reflected in the child because that's how children build up their emotional procedures based on their history of interactions. Some other things, like the multidimensional framework. And some of these things are a little bit difficult to think about, but it's kind of a review of what's in the Universal Language of Love book, as well as the chapter that did people receive the chapters and read the material? So it's a little bit of a review of that. So the multidimensional framework, how does it work? If you have the same coder for all of the EA scales, the 6 scales, they'll tend to blend a little bit. So one approach people have taken is to use separate coders. It's very difficult to do financially, to make that happen. Another approach is to have one coder for the adult scales and a separate coder for the child scales. Much easier to do financially in terms of resources in an agency. So a lot of people are doing that now. And you could do, let's say you have two coders, and some do, one does the adult scales, another one does the child scales, and on a different occasion, they could switch. And they could do adults, the second one can do adult scales, and the first one can do child scales. So that's another approach people use. What is not okay is having the scales highly intercorrelated. There's no reason to have a multidimensional framework if you're not using the multidimensional framework. And if you're coding sensitivity, not once, but you're coding it 6 different times, and then thinking you're coding sensitivity, structuring, non-intrusiveness, non-hostility, child responsiveness, and child involvement, you may be not doing that. So that's something that we will return to as a discussion. The 3rd edition of the EA scales did not have this requirement. It was called the same scales, but there wasn't a way to think about separating the scales. So in the research that's been published on the 3rd edition, there's high intercorrelation between the scales, because there was one overall conceptualization, and it was with sensitivity starting up the system. So if you gave a score of 4 on sensitivity, chances were very high that you gave a score of 4 on structuring, a score of 4.5 on the next scale, and so on and so forth. So they were very close. So in reality, you were thinking sensitivity as you were watching for structuring. And I think human nature, we as observers, and everybody has this problem, have a tendency, when we like the interaction, we tend to like all aspects of it. When we dislike the interaction, when we get a bad feeling, we tend to dislike all aspects of it as well. It's human nature. It's also called the halo effect. And what you really need to do is make a very conscious decision to do your scoring, and then take a step back and challenge yourself. Okay, I have this score for sensitivity, and I have this score for structuring. Is this correct? Because this is something that I see a lot of. I have a mother who scored a 4 in sensitivity, and let's say I agree with that, and then she scored a 4 in structuring. Well, the question I ask is, and I know some people are going through the course a second time and kind of went through me asking this. I agree with your score on sensitivity, but with respect to structuring, what did she do to get as high as a 4? Because sometimes the mother just looks nice, seems like a warm person, smiles every once in a while, so she's not sensitive in the sense of picking up on the child's cues, but she looks nice. She seems like a nice person. So if you're just warm and nice, but you're not sensitive to the child's cues, you can get only as high as a 4 in sensitivity on the direct scores, which are 1 to 7 points. You cannot get higher than that. To get higher than a 4, you have to be sensitive to your child. It's not just enough to be nice and warm. That gets you up to a 4, but not higher. But let's say you do nothing with the child in terms of suggesting, guiding, playing. and then she gets a 4 in structuring on the 7-point scale, the global direct scale. But she does nothing. So the question I ask is, what did she do to deserve a 4? But immediately when people give a 4 on one scale, they give that much on the next scale. But you have to ask yourself, you have to challenge yourself, was this structuring? And my sense is such a mother should get a 1, and if she does a little bit, a 2. No more, because she didn't do anything. So the EA scales, 7 of them, really need to be taken separately. All of the scales have the same worth. They're 7-point scales, as the global direct scores are 7-point scales. What that means is we value sensitivity no more or less than structuring, no more or less than the child's responsiveness, for example. So all the scales have the same values. Sensitivity is not viewed as the most important or complex quality. It's on a same footing. And as I mentioned, the research indicates that the other dimensions are also important. The system can be used with multiple caregivers or multiple children. It's used in family care homes, center-based care, where there are lots of people around. There are procedures described in your white manual about how to focus your observation if you're using multiple caregiving, multiple children contexts. There's also information in your manual about children with disabilities and how to think about that, as well as children who don't have the same history as their parents, or they have had other parents, such as foster children or adoptive children. There are ways to focus on the dyadic aspect. I repeat the dyadic often. So regardless of how many people are in the room, you are scoring one relationship at a time. So you go one at a time rather than one person's emotional availability in the room. If you were scoring teacher-child interactions, it would not be the teacher in the context of a whole classroom. It would always be one dyad at a time. In terms of scoring, you don't want to score the adult and then score the child. You want to look at them dyadically. You cannot say someone is sensitive when the child is not enjoying the interaction. It's a dyadic, relationship-based system. An interesting question, in case someone is looking for a research question, is, what are the limits of emotional availability? Can someone be highest in one relationship? And can that person be, how low can that person be? We don't know the limits of any one individual's EA.
Is it
Yeah.
Is it also possible to do it between parents? If you have a
Emotional-
family? Yeah.
The emotional availability of the couple?
Yeah, a couple.
Yeah. And I'm not going to be actually training on that today or tomorrow or the next day, but there is a couple version, actually. And I will include that in the future because we're starting 2 research projects on the couple. One where the child has a disability, and we're going to see whether emotionally focused therapy can help the couple relationship and measure with EA the couple relationship, and then measure with EA the parent-child relationships of the child with a disability. But the couple relationship potentially could be helped through EFT, is what we're thinking. Then we also have another one that we're going to start on the couple this year. So I really do see EA as a relationship concept, as illustrated in the ULL book, that could be applied across different types of relationships.
And there are the same 6
Yes.
sub-skills components.
Yes.
Yeah. Okay.
No components, however. The components are not there at this point. But it's the 6 global 7-point scales translated into couples language. So how do you tell if your partner is structuring appropriately? And so in the recertification course yesterday, someone came up and said, my partner is structuring. You know, I noticed that. And it's what does happen in emotionally available relationships, that people support, scaffold one another in conversation, for example, or in other ways. So it is a relationship language, a more general relationship language. In your white manual, you have 7 subscales. And did people have a chance to go through the manual? Read the manual some? This is the first, this is going through the course the second time for some people, and other people it's cold, basically. But you have had a chance to look at the 7 subscales? How many people? Okay. So there are 7 subscales for each of the 6 EA dimensions. And those are the components of EA. And that's the way you get the 29-point scale. But you also have a direct score that's a 7-point scale. The 7-point scales, how can I find them easily? Any tips? Between today and tomorrow, you might implement the tip. How do I find easily the 7-point subscales? I'm sorry, 7-point global scales. Because I love the direct 7-point subscales. That's how I tend to do my scoring. I like the components to check myself, but I go back and forth, but I love the direct scales because it's only 7 points, and I have a feel for, you know, this is a 4, this is a 3, this is a 7, this is a 6 in sensitivity.
Do you mean the part that's in blue?
In blue, right?
Yes.
Yes. And so you might get, I don't have them on mine, because, you know, I kind of live with this in my mind, but you might get some tabs to put right near the blues, you know, and you'll be able to find them easily for each scale. And so I see people doing that a lot. So one thing is the components provide a basis for reliability and limiting drift. Basically, for sensitivity, you know what 7 components you need to take into account. For structuring, you know what 7 components you have to take into account. And it's the same as the next person. So that does help people feel more grounded in a system that's quite large. The components can also be used to look at the strengths as well as weaknesses or vulnerabilities in a relationship. You can share that with clients, what they're good at. And so you have more areas of strength to share with them. With respect to sensitivity, maybe they're good in certain areas, but not in other areas. So it gives you a language to deal with that.
Is it a good idea to have a break?
Yes, it's a good idea.
Hans wil koffie.
Yes.
Just now or?
Yes, it's a good time. There's more, so it's a good time to. And then once we go through all of the PowerPoints, then no more PowerPoints after that, and it's just us going through video examples, discussing them, and scoring them. But you know, we get the concepts out of the way, and then try to apply the concepts, and just try to remember, you know, in the PowerPoints. And I can send these PowerPoints to you on email, so you don't have to worry about taking notes on them specifically. You will have these with you. But let's take our break and come back.
Within 15 minutes, you should come back.